for pregnancy planning, and if you're worried about whether or not a pregnancy can actually occur, if there's any problem with infertility, we might be worried about fibroids that are close to the cavity of the uterus. So those are fibroids that are called submucosal. So they're just underneath the lining of the uterus, or they're actually pushing into the cavity of the uterus. So those are the types of fibroids that might impact whether or not a pregnancy can actually occur. The other question is whether or not the fibroids are in a position where they might actually cause complications with pregnancy. So if they're extremely large, or if they're very close to the cavity and very large, we might recommend removing them before getting pregnant. Or we might recommend removing them if a patient has already been diagnosed with infertility or they're having difficulty becoming pregnant. So the first step in evaluation is often doing a pelvic exam in the office, and then usually a follow-up order some sort of test that takes a look or image of the uterus. So that could either be a pelvic ultrasound, it could be an MRI. And at the time of delivery, we know that there's a higher risk for blood loss or hemorrhage, and so we are, managing those things and aware of those things as we approach time of birth or delivery. If you're still of reproductive age, we do recommend doing some sort of surveillance, either on a yearly basis, having an ultrasound or a pelvic exam, to just make sure your symptoms haven't changed or the size of the fibroids hasn't changed.